A non-medical friend contacted me yesterday and wanted to ask me some questions about some of the care that they had received over the last few months. So a few months ago, they had been really breathless whilst walking and at rest. And their GP sent them into hospital for investigations, and they were diagnosed with a pulmonary embolism. This is a blood clot in the lungs, and they can be quite dangerous. The treatment is blood thinners. So my friend was prescribed some blood thinners for a 3-month course and sent on their way. Now, a few days ago, their symptoms had been improving over the last couple of months, but a few days ago, they started becoming really breathless again, and they were really worried that they might have another blood clot. They went to their GP, who, again, sent them to hospital, which was the right thing to do, because if you've got one blood clot, there's always a risk that you might have a second one, even though the treatment might stay the same, which is just, okay, well, you're on blood thinners already, let's just continue your blood thinners. Now, my friend was discharged from hospital and had been diagnosed with a viral infection. And they didn't really know why they had been diagnosed with a viral infection when their symptoms were identical this time round to what they were a little while ago. They had also had a repeat CTPA. So this is a CT scan that focuses on the blood vessels of the lung. It's called a computed tomography pulmonary angiogram scan, CTPA. So we're looking at the blood vessels specifically in and around the lungs. My friend had been told that there was no blood clot now and that it was just a viral infection. But they were worried because they didn't understand how that conclusion was reached, and they didn't understand that how they've got such similar symptoms now to what they had a few months ago, that how can it be a different diagnosis? So I was asked, and more than happy to help. And I asked a few questions about the sort of things that had been done, the investigations. And it turns out that this person had had all of their investigations done correctly, exactly what I would have done had I been working in the emergency room. And I think there was probably a bit of disconnect in the information that was given to the patient, which was my friend. And it made me think about the times that I've given information to patients, and I think I'm probably giving enough information. I'm giving them the important positives or the important negatives with a plan, but I never really explain, or it's not that I probably don't often explain how the actual reasoning behind my thoughts. So I can say that this CT scan, so for example, in this case, I could have said, oh, the CT scan is fine, doesn't show that you've got a PE, we'll treat it as a viral infection, come back if things get worse. But what it might have been better to do is actually show the patient the report. Maybe I would even print a copy of the report for them so they can just peruse over it in their own time. Usually these scans, what they write at the very first line is usually this scan was compared with the most recent previous scan, and it gives the other date. So the radiologist will be comparing it with other sets of imaging anyway, but patients don't really know that. They don't really know the thought processes that go on. So it just made me reflect on how doctors probably don't always explain their thought process to patients, and how sometimes it could probably leave the patient in limbo. There's also quite a lot of information that is delivered to the patient. So whilst they might be happy with it at the time, immediately at the time of being given the information, do they truly remember everything that's said? And once they've gone away and had a chance to think about it, they can no longer have access to that doctor or that person that gave them the information in the first place. And it can probably lead to quite a lot of confusion and quite a lot of angst. I'm just trying to think about how this can improve my practice. And I think this is one massive benefit that I've experienced from posting content on social media, because it's given me better clarity of thought. I tend to explain things in a much clearer way than maybe I did before, particularly if I've made a video about something, because it's helped to reinforce that problem, that condition into my memory. What have your thoughts and experiences been when you've been given information by a doctor? Do you find it's clear? Do you want leaflets or printed information? I always advise people, well, I have advised people in my videos that if they go to a hospital and they get discharged, to really get a copy of their discharge letter, because it should hopefully help explain the doctor's thought process. It should hopefully help explain the condition to the patient a bit more. I tend to send, if I've diagnosed a patient with a new condition, I tend to send them a follow-up text message using anonymous software. It's not from my phone. But I send them a text message with a link to the condition that I've diagnosed them with, so they can have some information and have a bit of a better understanding of what actually is going on, and allow them to do the research themselves as well. But yeah, what are your thoughts? I'd be really interested to hear this. Should I be printing information? Should I be signposting people to videos? Should I be just telling people to go to the NHS website? I don't know. Tell me what your thoughts are.